Good morning. I'm Dr. Tim Joshin, and we have Rebecca here. Today we're demonstrating the Dermaroller. It's just a pinwheel. It has needles on, surrounding this wheel, and it's really a great treatment for things like acne. Can I have somebody open that for me, please? We're using it a lot for acne and also for fine lines and wrinkles. What we do is we'll prepare the person with some topical numbing before we do the procedure. This helps to minimize discomfort. And trust me, I've done it both ways, and it's unbearable unless you do the topical numbing, for me at least. And I'm sure our patients feel the same way. So once we've let that numbing soak in for about half an hour, what we do is we just wipe it off. And for a lot of our patients, what I'll do is I will do a little bit of filler first, and then we'll do the Dermaroller, because I really believe that when you put the filler in first, it creates these little channels that allow it to maybe even seep into the holes that we have. Now, so what we've done is we've cleaned off the area, and when we look at Rebecca's scars here, you can see she doesn't have any ice pick scars. Those are the ones that are really punched in, and they're sort of secured in with scar tissue. And she doesn't really have the boxcar ones either. These ones look like little boxes that are deep into the tissue, and if you stretch out the skin, those won't distend either. So she's got these nice little rolling ones. You know, they're very superficial, so you know, we may at some point add a little bit of filler here, but I think the Dermaroller is going to be a great start for her. So as I mentioned, this is just a wheel with little pins on it. You can get these over the counter, but the depth isn't quite, it doesn't go quite as deep into the tissue. So what we're trying to do is just roll the pin back and forth. And the nice thing about the Dermaroller, especially in darker skin types like Latin, Asian, Mediterranean, African-American skin, is it doesn't cause a reaction with the pigment-producing cells called the melanocytes. So this is safe in every skin type. And what we do is we just go back and forth with this pinwheel until we get pinpoint bleeding. That's our end point. Another great thing about this procedure is it really is a lunchtime procedure. For most people, they'll just get a little bit of redness and maybe a little bit of swelling. Occasionally they'll get a bruise, but for the most part, just a little bit of redness and swelling. Now, for her, all we need to do is we just need to go back and forth on the areas where she has the scarring, so we don't need to do the entire face. We have alternative treatments, but I really like this one the best because it's affordable for a lot of our patients. You know, for acne-prone patients, a lot of times money can be a little bit of an issue, and so this isn't terribly expensive. And you can see we just go back and forth on that area. Now we're going to switch to the other side. Sometimes I'll just stretch the skin a little bit, and we just go back and forth. Making this. Now, how's the discomfort, Rebecca?
Minimal. Minimal,
good. Now, if you didn't have the numbing, I can guarantee you it would be super painful.
I would not like you.
Exactly. So, and for patients, sometimes we'll go for 5 or 10 minutes doing this. And I really like to see the pinpoint bleeding, which we're not getting a lot of in this case.
Sorry.
Now, in addition for acne scars, we will oftentimes combine lasers for them. We have a really nice one. I actually had the sublative done yesterday, and that's why my face is a little bit red. But it's a radio frequency device that'll help to shrink the skin deep. And again, like the Dermaroller, it's a treatment that you can do in darker skin types as well. And so that's really basically it. Now, after care for this, we'll just clean off the little bit of pinpoint bleeding, and we'll apply, you really don't have to apply anything, but you typically will apply a little bit of polysporin or an antibacterial ointment. You want to try to avoid sun for a couple days, you know, while it's pink, but that's really it. So, thank you.